if you've ever gotten to the point where you thought, oh no, this is serious. A lot of hands. That's exactly why we're here tonight. The thing that's fascinating about our bodies is not just that we experience pain, but it's what uncertainty does to us. When we are uncertain about what's happening in our body, we get afraid. When we become fearful, our behavior changes. Maybe we stop exercising altogether. We start thinking twice about going out and gardening. Maybe we stop even considering traveling with our family. Heaven forbid in the season of life I'm in that you would not go to your grandkids' sporting events. Slowly, we get less functional and life gets harder to live because of the fear. It's the fear that changes our behavior. So I want to introduce you to a dear friend of mine. Because every once in a while, a story, a person comes along who kind of alters your thought process around this specific topic. Her name is Erin. Near and dear to my heart, met Erin about 10 years ago. Came into the clinic when it was just me, Bethany, and the late, great Bennett Bear. There's a podcast actually about Bennett, our pup, and Erin, the impact that he had on her. To say the least, she has been a big part of my life over the last 10 years. When she was a little girl, she was a competitive swimmer because she is tenacious. That turned into a college scholarship for rowing. After college, she got into powerlifting, bodybuilding, really strong. Into her adult life, she started getting into Western shooting. Basically what Western shooting is, it's an agility sport where you're sprinting, cutting, jumping, diving, all while shooting a gun at targets, and you're trying to do it in the fastest time possible. She was 3-time world champion. I like to make fun that she beat all the 3 other people, but I've been a couple hundred, I'm not sure. But the truth of the matter is she is competitive, she's determined. And if you stop the story there, you would think, wow, Erin has it all together physically. She started off early, she was disciplined, and she has God's gift to genes. Joints must be strong, muscles, all there. Oh man, you would be so wrong. You'd be so wrong. In fact, since 1980, Erin has had 21 orthopedic surgeries. I know y'all can't see that, all right? And it's here nor there. The reality of it is it lists it off year by year by year of all the things that she's had to have done. The thing that is probably the most striking is her left knee. She's had 4 revisions on that knee. Most recently, a cyst had to be removed from the tendon inside her knee, and the wound got infected because it wouldn't close. When you've had so many surgeries, it's really difficult for that unviable tissue to heal. So it didn't close, so it got infected. That infection led to a knee joint infection. So they had to remove the hardware that had been in and out and in and out. And she had just half of a femur and half of a tibia with no knee joint, with a PICC line where she was in and out of the hospital. Eventually she was able to go home because she had loved ones that were capable of administering the antibiotics. It was during this time that I went and saw her at her house. And of course, I'm driving there thinking, I'm gonna do what I do. I'm gonna bring some hope to Erin. I'm gonna galvanize her and be like, you'll be all right. If you've known me long enough, that's probably my favorite thing to do. So I'm kind of prepping my thoughts, prepping my speech, what I'm gonna say to her. Quickly, when I got in there, I realized, oh no, this is actually a little bit more grave. Okay, the Donny galvanizing, this isn't the time. I actually probably need to stop and listen just a little bit, because what she said to me almost knocked me off my seat. She said the prognosis for what I'm dealing with, if the PICC line and the antibiotics don't work, is amputation. Whoa, that's not the Aaron that I worked with over the last 10 years. That's a moment that I'll never forget. You're gonna lose your leg? Holy cow, not you. You're so disciplined, you work so hard. You give everything you got so that you can be stronger for the next day. And here you are sitting, potentially going to lose your leg. Man, that really, really hit me hard. And it was at that moment, okay, and maybe a couple of moments after that, I don't know, there's a lot of moments in that interaction, that I thought, at what point do you give up? Like, at what point do you give up on your body and you think, you know what is probably best for me? The lazy boy. The lazy boy. That sounds really good right about now. But that was not what Erin did. Erin was not about the lazy boy. In fact, she went all of her life chasing difficult things. It wasn't going to stop now. So, tonight, I really want to give you a practical framework for when to go, when to slow down, and when to stop altogether. That's what we're here for tonight. Before we jump into that, I want to talk about one very important thing. The pain that which you experience, all of us raised our hand that we experience pain. The pain that which you experience does not always equal the degree of damage. Many of us in this room that are sitting here right now, including myself, most likely have rotator cuff tears. Did you guys know that? At some various degree, your shoulder, the muscles inside of there are torn. But yet, we don't know. It's really not painful, right? It's not stopping our limitations. We may or may not know that we actually have rotator cuff tears. But over the age of 50, it's highly probable that there are tears in that muscle. Okay, that sounds damaging. On the flip side of that, the other side of that, when you get a paper cut, it's the tiniest of flesh wounds, but yet wildly offensive. Why does it hurt so freaking bad? I cut my thumb 2 days ago because I wasn't paying attention. Hurts so bad. The reason is because we have this really cool thing called a nervous system. Okay? God gave us a nervous system, and basically the nervous system is an alarm for the body. And there's an appropriate response. When your house is on fire, okay? Smoke billows, the alarm goes off. You get out. Firemen run in. They're crazy. Why do they do that? Going the wrong way, buddy. They hose that baby down. Get the fire out. Try to salvage and save as much as they can. That's an appropriate response. Okay, an alarm. The opposite is also true. What happens with the alarm system when you just burn the toast? You burn the toast, a disproportionate response would be if the alarms go off. Shawnee, Lenexa, Kansas City, all come. Get their hoses out, run in there. They start spraying your house. The damage that is created because of that is actually far greater than the burnt toast. You got it? The level of pain that you experience does not always equal the degree of damage that happens within your body. That's really, really important. Another way to think about this is pain is an alarm. It's not always a verdict. Pain is an alarm. It's not always the verdict. So So speaking of flames, speaking of verdict, I want to ask all of you right now, is it okay if I bring up something that might be a little uncomfortable? You guys okay with that? I don't know why I'm asking. I'm probably going to say it anyways. I think I just want you to be prepared for what I'm about to say. We have been conditioned. We have been conditioned that imaging is the answer. But MRIs, X-rays, images, it's actually fuel on the fire. It's fuel on the fire. Let me give you an example. My brother, 52 years old, handsome devil. He's a handsome guy. Okay, he was a male model for his job. Never really worked. So his job was beach volleyball. Made a ton of money. Okay, did a really good job. At 50, he got in this crazy kick of like, I need to be healthy. Buddy, you live in South Beach, Miami. You eat nothing but chicken. All right, you're pretty dang healthy. Very, very, very healthy. So, at 52, just a couple weeks ago, I get a WhatsApp from him. And it's like 8 attachments, PDFs. With this below, you know how you get the pictures, the images, and then it's like the text? The text says, Donny, comma, I'm screwed. Do you know what all those PDFs were? They were MRIs of an incredibly active, healthy 52-year-old. One of the worst things that has happened to us in our lives is the portal. Right? You get the PDFs before you even go see the doctor. You start reading it, and guess what? You're freaking out. You don't even know what half the words mean. Type that sucker into ChatGPT right now. You might have been feeling good, but guess what? You're not feeling good anymore. My brother was freaking out. He had an MRI of his low back. His right hip, his left hip, his right knee, his left knee. Not sure how I, feel about just going to get imaging on a whim without a doctor's note. In one sense I like it, on the other I don't. But he was able to go and get that in South Beach, Florida. He just knows some people, right? So if imaging, MRIs, X-rays, things like that, if that's not the whole story, if the diagnosis isn't your future, then the question should be, what is? What is the future? What is the future? Did I miss a line? Click it. There it is. This is a picture of my family. I just wanted to show them off, honestly. We also just got these family photos last week, so this is like the most recent photo of the Dequines right here. Now again, this crew right here, they're crazy. It's chaotic. My house at night is crazy. It is loud. It is messy. There's more bodily fluids than anyone would ever want to know about. Toys aplenty. Constantly cleaning. Many of you have been in this stage. You remember maybe what that was like. It's chaotic. Now, here's what I'm getting at. This is the point of tonight. Had you thrown this onto my life 10 years ago, when I first met Aaron, no way am I ready for that. No way. It's crazy to think that you just automatically throw this chaos into someone's life out of a whim. Crazy to think that. It's absolutely crazy. There's no way that I would have been ready for that. But year after year, slowly, one child after the next, thank the Lord for that, I started to develop a capacity for this life. I developed a capacity for the chaos. My life was a little chaotic 10 years ago, don't get me wrong, okay? And it's not that my kids are just super easy. What's changed is my overall capacity. And the thing is that life is like this. Life is like this. Slowly but surely, we develop the capacity to be able to do harder things. The more and more we lean into it, the better off the results, the more that we grow. The same thing happens with our bodies. Muscles, tendons, bones, fascia. The more that you lean into it, the more capacity your body has to do life. The alternate is true. The alternate is true as well. When you do not challenge the systems, the muscle, tendons, and bones, your capacity decreases. Many of you in this room, if I stuck my kids on you for a month, a week, a day, an hour, you guys would have a headache and an ulcer. Not because you couldn't do it 20 years ago, you probably lived it. But your capacity for this has changed over time. Does that make sense? So when we think about our muscles, tendons, and bones, I'm not asking for what your muscles, tendons, and bones could do 20 years ago. It's important for what your capacity is right now, today. Because when we supersede our body's capacity, guess what starts going off? The alarm system, right? We start to have pain, we start to have symptoms, and then we start to get nervous, we get afraid, we change our behavior. So tonight, if it's not about imaging, it's about capacity. Our bodies adapt to the stress applied to it. So again, the goal isn't to avoid life. I got the slide here. I think I had it there. The goal is to increase your capacity for life. Because everything matters, and someday life is going to ask you to do some things. Maybe it's grab your grandkids, carry them down the stairs. It's easy when they're a couple months old and you're holding them and you're going down the stairs. 5 years later, you got the 5-year-old you're holding down the hands, right? And you got the 3-year-old wiggling. You're now trying to go down the stairs and you're 5 years older. It might require that. It might ask you of that. What we are all about, not only just here at Freedom, okay? Physical therapists, chiropractors, ancillaries, doctors, nurses, anybody that's personal trainers, you name it, massage therapists. What we are all about is so that we can prepare your body for when that is asked of you. That you are ready to take on that challenge, rather than be afraid to do it. That's where this baby comes in. We purposely didn't give it to you, but I have one for you, so that at the end, when we start doing question and answers, we'll start slipping them to you so that you can have it. This is that practical guide that I was talking about. It is weekly, if not daily, but definitely weekly, that somebody, usually a member, occasionally a patient, but usually a member, and a loved one will come up to me and say, Donny, my shoulder, what did I do? And what do I do? I get it often enough to where after a couple years I'm like, I gotta do something. This is that something, okay? And this something right here, I want you to put it on your refrigerator when you get it. Put it on your refrigerator. It's not because I want pain to constantly be on your mind, all right? Or freedom, woohoo, yeah, you know. What I want for you to have is a tool so that when that pain hits, you have a tool to go back to and be like, okay, where am I at and what's my next steps? Okay, where am I at and what do I need to do now? What category am I in? So we've created this green, yellow, orange, and red. Green. Green. Green is your body talking to you. You're getting some feedback. But it's telling you to keep moving, keep going. You're all right. Keep doing it. Let me give you an example. Happened just this morning. I kid you not, it was perfect. I was like, thank you, this is great. I needed a green light. Just this morning, a member said, man, I was pretty sick. I was coughing up a storm. I think I pulled this muscle right here. Hurts pretty bad. First question I asked was, how are you feeling today? She's like, I'm okay. Next question I asked is it feeling better? She said, oh yeah, oh man, a week ago, it was terrible. Here's what I want you to learn. The symptom happens when she coughs. It's pretty noticeable that coughing leads to the symptom, okay? So it's very predictable. Green means it's predictable. You know it's coming. The next one that's really important, not only do you know it's coming, but man, you see it sailing away. The symptom is going away. If it is going away and you can almost see an end in sight, that means green, keep going, you're going to be okay. Got it? Yellow, that's the next one. Yellow tells you, let's modify, let's change some things, but keep going. Let's change something, but let's keep going. This is when you are out gardening and your back kind of hurts, you know? So what you do, you get a chair and you sit on the chair and you garden in the chair. And guess what? The back feels better. Of course, the idea is not that you sit in the chair the rest of your life, okay? But you're there for just a time frame to allow for your body to heal and get back into the green. And eventually, the cool thing is, God gave us all the tools we need inside of our body, in our environment, to heal itself. But you need a few weeks to sit on the chair to let it to heal. But then eventually you find yourself getting back up. And then a couple weeks go by and you're like, oh, I actually don't even need the chair anymore. Awesome! We've all been there. That's yellow. Let's think about it from exercise, from fitness, okay? This is what we do all the time. The coaches are amazing at it. You do a squat, woo, the knee swells up, it hurts. You come back the next day, you tell your coach, hey, my knee hurts. So what do? They elevate the box, right? You don't have to squat so low. That feels much better. To repeat myself, the goal is not to stay at the elevated box. It's just let's stay at the elevated box until we can get you to that lower box again. It takes a little time. But the modification reduces and gets rid of the symptom. Let's jump into orange. The orange light. The orange light is when you are so tired that you need professional help. You need a little help. You've gone at it at your own long enough. You're exhausted. The symptoms are not changing. You've been at it for a long time. The symptoms are also starting to take you backwards to where you are wondering, should I, ... In fact, it's not even a should I, it's I'm not doing it. That's a problem, okay? Most recent example, again, happened yesterday. Working out with the gal, stops me, she's like, it's about that time. About that time for what? Gonna go see the orthopedic. Gonna get some imaging. I hear it all the time, right? Yeah, all the time. Oh, tell me what's going on. Like, why are we getting... I've had this sit bone pain for 6 months. It won't go away. And I know you're going to tell me to go get dry needling, but I'm not dry needling up there. I'm not doing it. I said, are you coming tomorrow night? Like, yeah, I'm coming tomorrow night. I'm like, great. This will be really helpful to go through this. She goes, well, I trust you. I'm like, well, the reality of it is you've been going at this 6 months, starting to take away from your quality of life. Every time she goes to take her shoe off, hurts to the point to where she doesn't even want to take her shoe off anymore. That's a problem. Okay, when she bends down, it hurts. The orange light is where we've been conditioned to think, I need imaging. It's when the panic button starts to set in. What's going on? I need answers. That's the orange light. My recommendation for you is to go to where? Anyone want to say? Physical therapy. You heard it. You said it, not me. I don't want to be profession biased. Okay, why? Why do I say that? Not because I don't believe in physicians. Okay, this is not a bash on physicians. We have some physicians here. It's not like I'm bashing on that. The reason why I'm saying that, when you go to see a specialist, 99 out of 100 times, what do they have you do as a treatment? Go to physical therapy. It's less than 1% that they're like, work, whoa, chop, lay down, chop it now. Right? No. They're sending you to physical therapy. Why are they sending you there? They're smart. They understand. Your capacity is low and someone needs to help you improve your capacity. 9 out of 10 times, that's going to work. If it doesn't work, you can come back. Right? You can come back and we'll take a look at it. I can go on and on and on about that, but that's not the point. The point is that when you're in orange, it's typically around that panic time when you're thinking, I need imaging. My challenge and my encouragement to you is seek professional help. Okay? Increase your capacity that direction. It potentially can reduce the fuel on the fire. It potentially can. Okay? Now there's red. There are times when you do not belong in physical therapy. 100%. I am not trying to just say, do this. Not at all. There are times when you are in the red. Red is telling you to stop. Stop doing it altogether. Here are some criteria for that. And again, remember, I'm talking physical stuff here. I'm not talking illness, sickness stuff, okay? No idea what any of that stuff. You're sick, go to the doctor, okay? I'm talking that pain that we're talking about, right? That pain that you experience. Here's some criteria for that. First criteria for that is anything that's sudden. If you have a traumatic experience, car accident, fall and slip and really collide, okay? That is trauma. It's within reason that there was enough force that something is wrong and you need to seek medical attention. If you slip and fall, land on your shoulder, and you're holding that thing up and you can't move it any direction without pain, you barely can sleep at all, and it's consistent. It's going and going. Go see the doctor. That's smart. Good idea. Another one. When you have sudden loss of movement of a leg, anything instant. Grounds to go to the doctor. In fact, orthopedic spine doctors or neurologists, okay, neurosurgeons, that's one of the top indicators for back surgery is when you have drop foot. When you're walking and moving and you can't move the leg, that's a pretty good indicator that a nerve is pretty well impeded. Another one, sudden weight loss. No GLP-1s needed here, baby! I just lost 15 pounds in 2 weeks. And I didn't even do anything. Alarm system. Red flag. That's red. When you suddenly lose control of your bowel and bladder, that's a bad sign. Unless you're my 3-year-old son, that happens all the time. Those are red. You don't belong in physical therapy. You belong elsewhere. When you look at green light, yellow light, and orange light, all three of those lights are challenging you to keep moving. There's only one that tells you to stop. And when they do tell you to stop, it's to help you be medically stable so that you can move again. That's the idea. In our profession, as physical therapists here at Freedom and in the group personal training, when you come to see us, we are trying to assess what your overall capacity is, physically and emotionally, because it matters. They play hand in hand. If you come from physical therapy over into the group personal training, right, I don't necessarily see you all that much. But your physical therapist has appropriately allowed and gotten you to a point where your capacity is in the group. If you don't, you come to see me for a discovery visit, it's not a sales gig. If it was a sales gig, we could probably figure out another way to have someone else do it. It's a capacity situation. I'm determining and assessing your overall capacity, physically, emotionally. Where do you belong? It's probably going to either be in the orange section, which is physical therapy. Let's get you in there. The yellow section, which is you can do the group personal training classes. You'll be fine. You'll be successful. Hey, let's talk with the coach about some modifications that can help you get into the right direction. Or green. Hey, baby, you're good to go. Get in there. Grip and rip. You're going to do great. Here's stepping stone. Here's milestone standards. Whoa, you're actually at your stepping stones. Good job. The whole point, though, is to help you understand the capacity that you're at functionally and where you're headed. Increase the capacity. Because again, the alternate is decreasing capacity, losing function. You're on one of the roads. You're on one of the roads. So, the big question that we need to ask ourselves as we go into this is, what does this all mean? What does this all mean? When I think about all that we've talked about, arthritis, rotator cuffs, capacity, pain, I don't think about that necessarily. What I think about is I think about Aaron's story. Aaron has lived green. Aaron has lived yellow. I have walked through a lot of orange with Aaron. And she definitely has lived red. She has definitely lived red. But one thing that Aaron has never done. Aaron has never let one season of her life convince herself that the story is over. One season of her life did not write the entirety of her future. She keeps going. She keeps moving. She keeps pressing on. She keeps increasing capacity. Aaron's story and Aaron just who she is basically reminds me how important it is to not think that we're going to have a pain-free life. We're not going to have a pain-free life. And the other thing too is we're not going to have a perfect body. We won't. The goal is not to have that. The goal is to keep living. Keep living. Keep living. Aaron had every right to shut it all down, to quit, to give up. Surgery after surgery, infection, bedridden, blood clot. She got blood clots because of the sedimentation of being at home. That's scary stuff. Went from amputation to life-threatening. Just like that. She kept moving. Most of us tonight, we're not going to face all the trials and tribulations that Aaron has in their life. Maybe some of you have, okay? We're not all going to face that. But we are going to face one specific question. As we age, as we get older, the question is, when our body changes, because it will, what are we going to do about it? What are you going to do about it? You are getting older. Your body is changing. What are you going to do? My hope tonight wasn't to try to give you a perfect picture of pain. That's not what my hope was. My hope tonight was that when your body's giving you feedback, you know what to do. It's a wide ocean out there. I know. It's a big wide ocean. And all of you have your stories. All of you have your stories. All I'm trying to do is throw you a life raft. Okay? Just a life raft. And maybe that life raft, when you're in the big wide open ocean, might just give you a little bit more clarity. a little bit more certainty. Because if you have just a tiny bit more hope, a little bit more certainty, a little bit more clarity, then maybe take a deep breath. We reduce our fear. We think about what the next steps are. Because your body giving you feedback does not automatically mean that your story is over. What questions do you have for me? Do your best to ask questions. It's helpful, okay? I do ask that if you have like a personal question, like, okay, man, I gotta ask about my knee. We can do that after. We have all the providers in the back there that can bring some clarity to your specific situation.
I'll ask.
Yes.
All right. So is the point, the goal to increase our capacity to manage pain?
That's a great question. Did you guys hear that? Is the question was, is the goal to increase our capacity to manage pain? The answer is yes, and the answer is no. If you are living with consistent chronic pain, right? The goal is not to just be able to tolerate it better. The goal is to get with the right professional that can help you manage it. Because if you're in the orange, you probably need someone to help you. That's the idea, right? And it's not that we're going to have this pain-free life, but it is also very important for us to understand that if you're having the consistent chronic pain over and over and over again, there are professionals that can help. So not to get too deep into pain neuroscience and actually how that alarm system works, right? That's probably the best answer I can give. Okay. Thank you. That was a great question. Yep.
Where's Erin now?
Where's Erin now? Come find out. She works out every Monday, Wednesday, Friday, 8:15.
Oh, she's here.
She's right back there in the white hat right there. She might kill me for that later. Sorry, that was Becky's fault. Any other questions that you got? There's one really, really important thing that I want you guys to get. Maybe you got it from tonight. If you get hurt, right, and there's pain, the goal is to not stop completely. The reason being is when you stop completely, your capacity lowers. And here's what we tend to have happen. We stop completely, our capacity lowers, right? But then we jump right back into the activity that kind of got us hurt in the first place at the same intensity. That's a recipe for disaster. I'll use squats, for example. Let's say you're squatting 100 pounds, okay? And then a culmination of things lead to back pain. It happens, it does. All right, you exceed the capacity, maybe because you gardened, maybe because you didn't sleep well because you were sick, you're coughing, maybe you had your grandkids all night, you know, all those things. Then you walk in and you squat, and your back hurts. All of a sudden you blame the squat. Well, man, there's a lot of things that happened. It wasn't just the squat. So you're saying, I'm never gonna squat again. So what you do, you stop everything. You stop squatting, you stop doing all that thing. Then you leave. Eventually, yes, we have healing agents in our body. Praise the Lord. We have white blood cells. We have everything we need to heal ourselves. It's pretty impactful. It's pretty amazing what we have. You sit and rest and it feels better. Then you come back and guess what you do? You squat 100 pounds after you've been not squatting for 2 months. Right? It's an inappropriate dose. You're putting yourself really at risk for the next thing. Here's the tragedy is then you do it, and your back flares up quicker than it did the last time, and then you are really, really convinced now squats are bad for you. That make sense? It's the squats' fault. They hurt. That makes sense? You got that?
Okay, so
Yes.
I've got a follow-up question. With everything you said, how does recovery factor into this?
Fantastic question. It's a great question. Recovery. How does recovery factor into all this? It's huge. Anytime that you move and require your muscles to work, it costs you something. It costs you something to use your muscles. And to not get into crazy physiology, that cost is a byproduct that stores in your blood. Okay? If you exceed your body's capacity, and you don't recover well, then you're just going to continue to store and store and store and store that byproduct in the blood. That's soreness that leads to more soreness, that leads to more soreness, that leads to stiffness. That stiffness leads to pain. It tends to go in that trajectory. Okay? Then we add on our lives, stress, cortisol. We talked about that 2 workshops ago. That's also something that stores in your connective tissue in your blood. And that adds to it, it expounds to it. So not only do we have physical stress that leads to a byproduct that stores in the system, but then we have the emotional stress that goes onto it as well. It compiles up over and over and over. And that goes back to my family analogy, right? Eventually you will be able to tolerate a little bit more lactic acid, a little bit more cortisol as you inch yourself into it. But if you just jump into the deep end, many of you going back and trying to raise my kids, heaven forbid something happened to me in Bethany, but if you got required to do it, it's going to be very stressful for a long time until you slowly build your capacity back up for it.
Just take one.
Okay? That was a long-winded answer for yes, recovery matters. The dosing matters because it all goes back to your capacity. What do you have the capacity to do? Okay? And if you exceed your capacity once, your body talks to you, you're still in the green light. You come back down, change your dose, change your load, change something about it, then build back up. Right? Your body will talk to you. But recovery is huge. Of course, recovery plays a role. That's a very good question. Any other insightful questions out there? Okay, here's what we're gonna do. 7:45, right on time. Pretty good, 7:43. And okay, we're gonna do the same thing we did last time, okay? Calf. Well, first, can we give Mackenzie a hand? Where's Mackenzie at? Doing a great job of setting this up, and then obviously the rest of the staff are here to help to bring value to you. Kathy has made a whole bunch of treats and snacks. So go over there, get some snacks. Looks like little pies. Okay, go get some snacks. What I am gonna do is, same as last time, in about 10 minutes or so, if you guys wanna come back, I'm gonna share just a little bit about my testimony, a little bit about my story, my personal story. It'll only take about 5 or 10 minutes. So if you wanna hear just a little bit more about me, you're more than welcome to come back. The workshop's over, everything's done. Let's make sure that you guys all get this, okay? Put it on your refrigerator, live by it. It explains green, yellow, orange, and red. If you want to come back in about 5 to 10 minutes, we'll play some music. We'll turn the music off and you guys can come back, okay? But the workshop is done. Appreciate you guys.